All right, as kind of last matter of housekeeping here, I'll go through the agenda, but if you would like for us to email you these slides and the link to the recording on our YouTube, if you want to go ahead and include your email address in our chat box for this meeting, your name, title is great, and your email if you'd like for us to contact you with these slides and video. They will be available on our website for everyone though. So this would just be another personalized way to get them from us. All right. I will go ahead and get started here with the agenda. We'll go through, this is what we'll go through today, and I'll hand it over for the first pieces to our wonderful superintendent to go over our Verdant background. I'll cover then kind of the funding specifics, the nuts and bolts, both for those new applications as well as the year 2 and 3 renewals, and a brief highlight on the COVID-19 emergency funding we also have available. And then we will be opening this to questions and answers to make sure that everyone has an opportunity to ask questions, and that is never a one-time offer with us. Please feel free to reach out at any point if you have questions or I can be of any support. My contact info will be embedded in the slides as well. All right, without further ado, I will hand it over to Lisa.
Wonderful. Thank you so much, Zoe. And I'd like to thank everyone who is joining us today for this Q&A session. We are delighted to have you join us and share some updated information. Quick recap. Our Health Commission is a public hospital district number 2, and we are governed by 5 elected officials who are commissioners. Our most recent addition is Carolyn Brennan, and newly elected Jim Distelhorst, who will be our board president starting later this week. And then our other commissioners, Bob Knowles, Ida Knudsen, and Kariana Wilson, continue to serve their terms as well. And we are very excited to have their leadership and support. On the staff side, we have myself as superintendent. You just met Zoe, who you've had the opportunity to work with, or at least most of you, I hope, have had the opportunity to work with Zoe. She's a delight. And Thea, who has been instrumental in helping put together not only this presentation, but many of the videos that you may have watched if you have gone about setting up your grant portal account that we use for grant applications now. And then also supporting us today is Casey Kelly, our executive assistant and office manager. And thank you, Casey, for joining us as well. We would like to share with you that we are configuring and offering a new position that is open right now for recruitment, and that is a grants manager position who'll be working very closely with Zoe. So if you know of anyone who's interested, please encourage them to go to the verdanthealth.org website and look at this great job opportunity for this new position that we just created. Next slide, please. Little recap, and for many of you, this may not be new information. However, we do like to remind ourselves in the community that our focus as a health commission is to improve the health and well-being of our whole community. And we are looking to be a sustainable resource for the health and well-being of the residents we serve. And we are governed, as I said before, by a board of voter-elected commissioners who serve for 6 years. Next slide, please. Really brief recap of where we've been. During our first 10 years, we offered both one-time and multi-year grants. And in 2020, we added COVID-19 emergency grant funding. In 2021, we streamlined our processes and also began adopting an online grant portal. And so now we are operating with quarterly windows for one-time and multi-year grants and continue ongoing COVID-19 emergency grant requests as well. So both of those are available through our website grant portal for you to access and to apply. Next slide. We always like to take a moment to remind ourselves and the community of our service district. Public hospital districts have service areas. And so this map is a great illustration. So because of our charter and because we're a municipal agency, we need to ensure that the funding that we grant goes to serve the residents who reside within this service area. Next slide, please. For those of you who are trying to figure out what that exactly looks like, this is an overlay with Edmonds School District and their service area. And you can see we, for the most part, overlap significantly with the Edmonds School District. There is a little bit area outside of Briar into Bothell that is in the district, but is not in the Verdant territory. We have also provided this information by zip codes for those of you who are looking at serving our residents to help you guide where delivery operations could be for those residents who reside within the hospital district territory. And I think this is my last slide. The purpose of these grants really are to support projects in Snohomish County and focus on alignment with Verdant's mission. We are seeking projects that address priority areas identified by the commissioners. Next. Oh, I guess I do have one more. These are the priority areas that we are currently focusing on: access to healthcare, behavioral health, childhood obesity, dental care, food security, support for housing, other education and prevention, and supporting seniors.
I can take it from here, Lisa.
Okay, thank you.
Yeah.
I thought it was the cutoff before, so I want to make sure. Thank you.
Yeah, absolutely. Thank you. We just like to provide some additional kind of definition for these two specifically, as the others are a bit more self-explanatory. So for the priority area of housing, what we are currently meaning by that is helping people gain and sustain housing. That does not mean or include the capital development of actual housing facilities at this point. Again, for the other education and prevention, these are kind of ideas that support resident health and wellness, and they really may include addressing any of the social determinants of health or other emerging needs in the community that the community or the service provider has identified. I'll move into the funding parameter requests here. We do not have a minimum or maximum request. We don't have a firm guideline on that. We prioritize direct program expenses. Again, so rather than overhead or administrative costs, we seek to fund direct program costs. We fund multiple programs in each priority area. So it's not a competition to see who gets the food security grant this quarter. We do fund in multiple in them as requested. Like Lisa mentioned, these requests must be to provide services that serve South Snohomish County residents. So again, referencing those district maps and zip codes. It's not a requirement that all of the services take place in the service district. That is always our preference. But the core requirement is that the services are for our residents. That we are limited and that we cannot provide funding for the benefit of an individual person, for political or religious uses, to retire debt, or strictly for general fundraising purposes. And we also will not be awarding capital or solely equipment requests in this quarter's funding. Next slide, please. The evaluation criteria for how grants are scored, and you can see there's a link here to the actual scoring questions and ranking process. So these are scored by staff as well as the commissioners, is both by opportunity and community need, a demonstration of community impact and diversity, equity, and inclusion, the desired outcomes of the work, and the implementation capacity. Next slide, please. Thank you. Giving a brief overview of the COVID-19 funding before we go into this quarterly process. These are accepted on a rolling basis, and so you can submit a request at any time. They are via our grant funding portal. If you've created an account for your organization and yourself, you do not need to create a new account to access this funding opportunity. When you click on apply for funding in the grant portal, you will see an opportunity for traditional or multi-year awards as well as COVID funding. Similar parameters to our quarterly kind of traditional grant process is that they must serve South Snohomish County residents, so that same geographic area and requirement, that they must support a verdant priority area, as we previously discussed, but also a community need that is a result specifically of COVID. And typically these are more short-term projects or pilots. These are not intended to provide funding for, a year-long intervention or for work that has already been identified or has been occurring long-term. It's truly to kind of do a proof of concept or recognize a short-term need in the community that is specifically related to COVID. Here you'll see a link to more information, and all of this is on our new website that you will see. Same address, but new look for our website here, verdanthealth.org. All right, now we'll move into our this quarter's grant process. So all applications are submitted via our grant portal. We're going to give you some video demonstrations and links to how to get set up in the portal and as well as what the application forms look like, because all applications are submitted via that portal. For this round of multi-year funding requests, we will be accepting applications from January 31st at 9 a.m., so a week from today, until February 11th at 5 p.m. More information on creating a grant portal account and submitting an application can be found under the grants funding opportunities section of our website. There's a link here, and we'll go into more detail as well in this presentation. Next slide. This is going to be an orientation to what the forms look like within Flux. So this will be for folks who are applying for a new kind of 3-year request, not for folks who are doing just their year 2 or 3 renewal request, because that will be just the budget and outcome section, not the full narrative section. This is going to take you through kind of the key components of what the application will look like. They are adapted based on our previous paper forms. So questions, kind of budget format, outcome descriptions are all the same as when we were using paper. They are just now in this electronic format. Important to know is that this table of contents that you see here will help you navigate to all of these sections. You can click on those links and it'll take you right to those places. Also wanting to highlight that each section must be filled out completely in order to submit. And we also here we have placed a Word document version of our narrative questions on our website, again under the funding opportunities piece, so folks can start drafting those narrative responses in a Word document and then copy and paste them into Flux, and or they can utilize this as just an editing process if that works for you. Editing can also occur within the system between multiple staff members of the requesting agency, as well as between myself and the requester. Prior to the end date, I'm always happy to look at or provide feedback as folks go through this process. Next slide. Required documents, you'll see that we continue to ask for a list of organizations' board of directors. This only needs to be updated once, and then you can replace it if your board membership changes. We annually ask for current financial statements, and we have some details around what that means depending on the size of your and type of your organization. And then there's the ability to attach other documents or attachments that you would like for us to see, whether that be an annual report, but those are not required. Next slide, please. Again, utilizing the same kind of prompts as we did in Excel, this is how outcomes will now look in our grants portal. So everyone is required to include the number of individuals served and then kind of annual goal as one outcome, and then have the opportunity to add additional outcomes that they think best demonstrate the impact and kind of importance of their work. You'll see there's a checkbox there that I've added a number of individuals served as an outcome metric. That's another important one of those just kind of added in stop signs to make sure folks remember to do that. Similarly for budget, This utilizes a spreadsheet-like functionality that is just embedded within the system, and it's also how you will report on your actuals. Next slide. And now I think we are going to highlight what it looks like to create an account in our grant portal. Let's see, Casey, I am not hearing audio.
This is a video tutorial on signing up for your grantee portal account. So you're going to start at the Verdant Health Commission Grants Portal home screen. You'll see our logo in the top center. And you'll see on one side it says login now and the other side has this welcome text. You're going to want to scroll down to the bottom of the welcome text and click this create an account now. You will click there and you will be met with some eligibility criteria. Please note that you must pass these eligibility requirements in order to be taken to the next step of inputting your organization information. So if the answers that you entered do not pass, so if you fail this eligibility requirement quiz, you will receive an error message and will not be able to move forward in Flux. The first question is that your program takes place within our service area. Your next question will be that you deliver services that improve the health and wellness of our community. The next one is that your services increase access to our priority areas. This one is acknowledging that your funds would not be used for the benefit of individual person or for political or religious uses, etc. And your last one is that you have a business license or a fiscal agent and are eligible to receive a grant from a public agency. So once you acknowledge all of those, you will hit the submit button. So if I hit submit, I will come to this screen where I'm going to input the info about my organization. So you'll put your organization name here. Anything with this red asterisk is required. So that is what that little red asterisk signifies. You're going to want to include your address, city, state, so on and so forth. You then will want to include your organization phone number and your organization email. Then you'll want to include your tax ID here and your organization mission statement here. This one, your organization summary is not required, but it is important for you to fill out the organization summary and the mission statements, as these are automatically pulled into your funding request. So please note that and make sure that you also keep them up to date once you are in Flux as well. And the next step is going to be your primary contact info. So this is your contact information for yourself. And again, anything with the red asterisk here is required. So you're going to want to review this information before you submit it. If you do submit and you realize something is wrong, you will be able to edit this information later. So there is no stress there. You will hit the submit request button and you will receive this memo that tells you that your information has been submitted and you'll receive an email from us within 2 business days. That is really important because if you are planning on filling out an application, you will want to sign up and give yourself a few days after signing up before you fill out the application. So do not expect to fill out your application immediately after setting up your account, as it does take a couple days for that confirmation email to be sent to you. This is an overview of the organizations tab in the grantee portal. So we're going to start.
What you're seeing here is that we have a playlist of video tutorials on our YouTube page, and we'll be orienting you to where you can find all this information. It's also embedded within the grants portal about what each tab means and how you complete a variety of functions. We have both these video demonstrations as well as PDF training guides. So we'll show you where those are. And again, if you ever need assistance navigating Flex or have any other questions, please don't hesitate to reach out. So this is also important to know, is that if you had failed that eligibility quiz, you would not be asked to do the piece around adding your organization and people. You would just get that error message, as Thea referenced. So if you get to that place, again, just confirming that you are eligible to apply per our kind of requirements and limitations we covered previously, then you will do that organization and personal contact information, and you will then receive a link to set up your password into the system once it is fully processed. Once you've done that, then you are able to apply for available funding via the portal. It is important to note that while you can always see the applications, you cannot always submit an application. So if you were to go in now and start working on your application, you would not be able to submit it until the open application period. Just a heads up if anyone gets concerned about that. Now we're going to do kind of a preview of the what that whole multi-year application process looks like. Again, the full video and our full robust training guide as a PDF are available on our website and via our YouTube page, which we'll provide links to. This is meant to be a very intuitive, efficient system for our grantees. And we did utilize, as part of our demo process in selecting a vendor, we had a subset of our grantees participate in those demonstrations. And this was the highest rated in terms of usability. And we hope that that continues to be the case for our partners applying for grants and doing their reporting via this system. All right, Casey, do you want to give this a play here? We'll do just a couple minutes of this longer video.
Can you guys see that, the home screen? Perfect. So at this point, obviously you're already going to have done this side. So you're just going to log in with the email and password that you set up for yourself. And hopefully this will work. All right, click sign in. Like I said, my internet's a little sluggish today. And you're going to be taken to your grantee portal home screen. There we go, which looks like this. And from there, it's super self-explanatory. You're going to hit apply for funding right underneath the information tab over there. So we're just going to focus on this multi-year health program funding. So over on the right, you're going to click this button that says apply for the multi-year program grant, and you're going to be taken to the application, which looks like this. So you'll have up at the top, you'll see your organization name, and then you're going to see this table of contents right here. A couple notes before I start going through the application. This table of contents doubles as a navigation tool. So I can navigate to the different sections of the application by just clicking on them. So like if I want to go to budget, it'll take me down there. That's important because you are on a computer, and computers sometimes don't like to be nice, and you might get taken back up to the top for whatever reason. So instead of having to scroll through the application, you can just click on these and you'll be taken to wherever you want to go. I also want to point out these little red asterisks right here. Like was mentioned in the video, those indicate a required field, so you won't be able to submit an application if one of those is left blank. Another note is these little more information. Those are PDFs. that are linked, and they're scattered throughout the application, and they just provide you more information. So like right here, they're indicated by this blue font. And if I click on them, hopefully this will take me where I want to go. There we go. And you'll be taken to a PDF that will give you more information on whatever it is you clicked. So in this case, the primary contact and the primary signatory. And I'll try and point those out just a second as I go. The last one is I want to point out the save and continue and the save and close button down here. They might switch places. I figured out as I've been navigating through the portal that whichever one you used most recently in the portal is going to appear on the right. So watch which one you're clicking. However, if you do accidentally hit save and close instead of save and continue, it's not a big deal. I'll show you. So if I hit save and close, it's going to take me to the submit screen. But I can get back to the application by just hitting this edit button up in the top right hand corner. So as you, if it wants to take me back, there it goes. Your save and continue button is your save button, so save as you go. I'd recommend using this at the end of each section or anytime you input a large chunk of text, just to make sure that your progress gets saved so you don't lose anything halfway through the application. All right, and I think that was all my little notes, so we're going to start going through. So you're going to start with your organization information.
If you want to
Some of
pause
this
here
will
for a minute.
automatically be pulled from your.
Thank you. And this is a pulled from our last Q&A, which was the first time that we had utilized our grants portal. So this is exciting to be continuing to learn. Thea, did you want to show additional content here? Do you think it's makes sense to move into the renewal piece?
I think we can head into the renewal piece. This video is on our YouTube. It's also on our website in the same that same spot we mentioned earlier to find more information. So there's a playlist on our YouTube, like Zoe said, that has all the different videos that will guide you through each piece of the portal. So.
Excellent. Thank you, Thea. So what we're going to do now, so for folks who are on the call, and I see a few names who are just going to be ending their first year of their contract that went through this process last year. This will be what you do just to request the year 2 and 3 components of your funding contracts if you requested 3 contingent years of funding in that initial application process. This is a much more streamlined and straightforward process. You do not need to resubmit any narrative, and Thea is going to be demonstrating both where you find this in the portal in order to kind of put this data in the system and what data is required. Over to you, Thea.
Yes, just in case you were not sick of listening to me talk, you get to hear me some more. Just a sec. My thing is, there we go. All right, so as you probably have seen in all the different videos, this is your portal home screen. So that renew button is right under request, this middle one that says request to edit or renew. So this is where all requests that we send back to edit will be, or requests that need to be renewed. So you're going to click on that, and I have this one sitting here. And the directions for the renewal are all sitting up here in detail for you. So just read through that before you renew. And it will say either year 2 or year 3 based on which one you're renewing. So basically you're going to see your application here already all filled out. And then what you're going to do is you're going to change the program budget for year 2. So you're going to update that to reflect year 2. Ooh, it actually might not let me.
You have to click the edit piece first.
Oh, thank you.
This is the first time we're doing this. So these first 2 quarters, right? We get something new each quarter for a while.
There we go. Perfect. And it'll look the same as when you're editing an application. So same thing with the save and continue and save and close down here. And you'll see that anything you need to input information is going to be, you'll be able to fill it out. So like these ones are closed. You can't fill any of that in. These ones you can see that they are light gray rather than the black text. So it won't let you fill anything in that you're not supposed to change. So start date, you're going to change. Oh no, I guess, does it stay?
No, it's assuming the next year. So it's that one
Perfect.
autoed into 22 to 23. Yeah.
Perfect. Again, new system. We're still working out kinks. There's still things we're learning. So you're going to update your budget for year 2. Total program budget is the total budget for your program. And the amount requested from Verdant is how much you're requesting from us. So it'll look like that. Whoop. Stay. And then you're going to scroll down to the budget section and you're going to refill out your budget and your outcomes and update those for year 2. So basically this whole narrative section will stay the same. You're changing your budget and your outcomes, and you're going to re-acknowledge and add some documents. So here we go. The grantee, let's add a budget. Here we go. Ooh, let me go double check what that start date was up there. If the dates do not match, it will not let you submit. That is important to know. So make sure your dates match. I'm actually going to write these down. Go back down there. There we go. Edit it. Perfect. So I'm going to input the start date, end date, all right, and then same thing you did on the application. So you're going to update your different budgets here. The important part is that although this says optional for the renewal, if you are asking for more or less this year, we would like you to include that down in this section below, just so we know. So although it says optional, if something is different in year 2 than it was at year 1, please fill that out and let us know why that changed. And again, these are just text boxes, so you can just type in it, hit save. You won't be able to see your comments from this screen, but they will go through to us, so we will be able to see them. And then I think if we hit save and continue, it'll refresh and you'll be able to see that little percentage right there. So you can see that the percentage is 50%. And like I said before, after each section, I would just hit save and continue just to make sure it's saved. If you get kicked out of your application, you can go back in and all the information will still be there. And then you're going to refill out your outcomes for year 2. And the first one, make sure you input your number of individuals served. Save. Uh-oh. Like I said, this is why we save things, because I'm going to get kicked out right now. Let's see if I refresh it up here. Reload.
If that doesn't come through, I'll let you do that piece.
There we go. Down to the outcomes. Pardon the technical difficulties today. I don't know what's going on. And that is a prime example of why we save things right there. All right, so now we're back to outcomes. We have our number of individuals served there. So I'll check that box that I included that. And then you can include however many outcomes you have. So again, just input the metric, whatever your goal is, and they're just going to appear in that table list format right here. And then you're going to go through and re-acknowledge all 4 of these acknowledgements. And the last step is going to be just updating your financial statements, your annual financial statements. You're going to update that document. Your board of directors should still be down here. So you shouldn't need to re-upload that one, but you will need to re-upload a financial statement for that year.
And this is one important thing we learned as we've gone through this, is that if you click right where Thea just did, to the right of the actual title of the document where it said financial statements, it will automatically track to that piece. If you click under required documents, you just need to make sure you're selecting financial statement or audit in the drop-down menu next to the file name. And you're all good. You can X out of that, Thea.
Perfect. And then we will hit save and close, and it'll take you to that submit screen.
And it will probably say update right now because we're not accepting any proposals right now. Oh, no, I did. I changed it for you. Okay, good. Submit.
Okay, and you should get that little notification at the top that it's been successfully submitted if everything is in there right. If it's not in there right, you'll have a little error notification at the top, and it'll tell you where the error is and what you need to fix.
And that is the entirety of information for our year 2 and 3 folks. There's no narrative, no pieces there. It will be just adding that total program budget. And we'll see here, we get that notice that you have successfully updated it. You're all done. So that's the piece for our renewals, is just adding in that updated total program budget, total verdant request, the budget and outcome spreadsheets, the acknowledgements around that you are authorized to be submitting the application, that you have all the kind of legal requirements in place, current financial documents, and then submit. So a different process than you will see in that kind of longer application that does require you to complete all of the narrative and other sections that were grayed out in that renewal application snapshot. Okay, thank you, Thea. I'll put you on the spot there with the live demonstration. So that was great. And Casey, could you pull the slides back up for us, please? All right. Before we open it just for new questions, we always like to cover some of these questions because they come up a lot and they're great questions, just in case these are ones you might be thinking. And then we'll have the opportunity for folks to either type question in the chat box for us to respond to, and or unmute and ask yourself. The first question is, do programs or projects need to serve a specific population? And as you'll see here, the answer is the only requirement is that they must serve residents of our service area. And so you can see again in the maps previously in this section, which largely match the Edmond School District boundaries. The question is, who is eligible to submit an application? Answer being that nonprofit, for-profit, and government organizations whose program matches our guidelines and eligibility criteria. Question, if my program or project is currently supported by Verdant and is set to expire, can I renew using this process? The answer is yes, and this is a good semantics lesson. So there are those year 2 or 3 renewals that go through that budget and outcomes, but if your 3rd year of a contract is expiring, you do need to go through the whole application process to request an additional full contract term. And that is what you will do via this application process and window. Next slide, please, Casey. Can I submit multiple applications? The answer is yes. The question being, what has changed with this application process to reflect equity, diversity, and inclusion? We both made edits to the application itself to include descriptions of how the program or project demonstrates equity, diversity, and inclusion. And it's also included as part of the scoring for the applications itself, as you saw in that evaluation criteria. And this is something that's very important to our Verdant staff as we work to increase our knowledge base and action around diversity, equity, and inclusion. Here are some key dates for this application cycle. So again, today is our kickoff here, our Q&A session on January 24th. We will accept proposals January 31st through February 11th. You'll see that we begin our review with our program committee of our commissioners on February 14th. And these dates actually did not get quite updated from the last time around. It is our April 1st is when our contract starts. So the communication to all applicants follows our March 23rd full board meeting. So people will be hearing the end of March around their applications, and contracts will be set to start between April 1st and the end of June. Our next contract period will have applications available to start, or contracts available to start July 1st. Next slide. All right, application deadline. That's probably the most important date here, Friday, February 11th, 5 p.m. This is my contact information here, my email and phone. And please do not hesitate to reach out either about Flux or other questions. And now wanting to make sure that we open it up for folks who have questions that we did not cover, and love that there is this QR code to link to our new social media and website. So we are now more active in social media on Instagram and otherwise, and you'll actually see some of this material highlighted on our social media channels. I do see a couple questions coming through. Let's confirm how many opportunities are up per calendar year. There are 4. So we use quarterly grant making, and so there will be an opportunity now, again in April, over the summer, and then in the fall for contract start dates of April 1st, July 1st, October 1st, and then January 1st of 2023. Secondly, when will we be able to access the request to edit? Great question. You will be able to access those on January 31st. And you will also see, and I think I've communicated with several folks, that I'm actually manually inputting all of the information from your year 1 application. So if you're like, what the heck, there's no grayed out text in there, I didn't apply in Flux, I am transferring your paper applications into Flux. So what you will see is that kind of 1 in the request to edit or renewals section, and that will be of the information that I have pulled over from your paper application last year. Same time frame. You will be able to submit those starting Monday, and they need to be submitted by February 11th. Absolutely. Any other questions? I do see that our wonderful Nancy Budd, our social worker at Verdant, is on the call as well. Wanting to highlight, we included our grants staff on that slide as people who you might be most likely to reach out to as part of this process. But we do have a broader, wonderful team at Verdant that includes Nancy, our social worker, Sandra, who does community outreach and engagement, Casey, our office manager, is on this call. So we do have a broader team who are all wonderful, and I'm glad some of them are here today. Question, could there be opportunities for capital grants in the future? Great question. So semi-regularly, Verdant does capital opportunities, you may have heard, called Building Healthy Communities funds that are significant capital investments, the last of which was in 2018. We are not planning to do during the 2022 calendar fiscal year that significant of a capital opportunity, but hope to have an opportunity for smaller capital costs during this year, and we'll keep everyone posted on if we are able to do a larger capital opportunity in future budget years. Let's see. Great questions. And again, I do want to reiterate that I know for folks who've applied previously where you could send a draft to me as an attachment and an email, that offer still stands, I can see it in the system. So I can see it when it's in draft form. You can send me an email, just let me know, hey, I kind of have what I'm thinking in there. I'd love some feedback. I'm happy to meet with you, talk through that. Probably more relevant for those newer applicants than just the outcomes and budgets, but happy to do any of that. I will say it's embedded within those text instructions for the year 2 and 3 renewal requests that Thea highlighted. We do not anticipate making significant increases in budget awards for the year 2 or 3 based on the year 1 approved amounts. But as Thea said, if you are requesting a different amount than you received in year 1, we really do want the context of that request within those narrative fields under the kind of budget numeric input fields. So that's another place. Reach out. Let me know if you want to talk through that at all. All right. As next steps, again, this recording as well as these slides will be on our website probably by tomorrow as soon as we get the recording from the cloud. And we have a robust menu of video and PDF training materials both on our website, on our YouTube channel, and embedded within our grant portal once you've made an account. But please do not hesitate to reach out if you need help navigating that, or we can be of any support as you consider an application. Lisa, I'll turn it back to you for final words here if there are no more questions. Oh, you're still muted.
Trying again.
There we go.
Thank you, everyone who joined us today. As we navigate our new online grant portal, we are always open to feedback and committed to continuous improvement. So as you experience interacting with our grant portal, please let us know if you have any suggestions for how we can make this process easier for you. That's why we are here. And our wonderful team is here to help you and support you, answer questions. You can share ideas. We are always looking for innovative programs and services that will increase access to healthcare for our residents. So thank you again for your time, and we look forward to seeing your proposals. Thank you. We're stopping recording.